Hello, my name is Thomas Keenan. I'm here from the University of Illinois School of Social Work Master's Program. The grand challenge that I have selected is to harness technology for the social good within the stronger social fabric. I currently work and intern at the Unity Point Outpatient Behavioral Health in Peoria, Illinois. In my internship, I currently lead PSR groups in Paswell County as well as provide on-call response services to our clients when therapists and support staff are off the clock on weekends. I also assist with detox and crisis management at the Crisis Center. Beginning on September 1st, I stepped into this role of assisting individual consultation with our clinicians, as well as assisting our policy and process improvement unit. Our services cover a very large multi-county metro coverage area that includes Peoria County, Tazewell County, and Woodford County. Before entering the subject that I bring today, I wanted to address what competencies this addresses. The numbers below that I will list are the competencies included. Competency 1, 4, 6, 7, 8, 9, with an emphasis on number 4, which is to engage in practice-informed research and research-informed practice. Also, listed here on this slide are the topics that I will be going over today. Harnessing technology for the social good within the social fabric of Unity Point Health, the need and choice in advancing care with online video telehealth, project implementation and the importance of it, populations that it'll serve, what does current data and research provide, how was research implemented into this project, what challenges does this bring up, and what have I learned as a new social worker. As spoken about earlier, the grand challenge that I bring today is harnessing technology for the social good within the social fabric of Unity Point Health. I found this most important and most necessary to serve the population receiving care within the Tri-County area. This includes Peoria County, Woodford County, and Tazewell County within the outpatient setting. I found it important to keep my goals for this project aligned under the acronym IAI for improving, alleviating, and integrating. Improving details taking current programs and initial readings over its current policies related to electronic use in client care. The process of changing any policy for Unity Point must first go through the current policymaker for Unity Point Health Central Illinois, who communicates with the state of Illinois and the headquarter base out of Iowa. A policy change begins with the unit director of the department who seeks to change that policy. For this subject, and any adaptation to this policy must be approved by the Director of Outpatient Behavioral Health for Central Illinois. This then is brought to the Leadership Board and is either accepted or denied or changed according with state and federal law. Our policymaker, while present, must then bring this pre-approved policy to the state of Illinois, where it goes through more steps. It is a lengthy and detailed process. To alleviate details, the motivation for change under said policy to improve use of telepsych within Unity Point Health outpatient locations. The current burden of ratio between patient to provider care is far outweighed and not enough providers to provide care for the population that seeks outpatient mental health care within this Tri-County area. Telehealth could assist with alleviating the stress and current high turnover rates due to the caseload sizes. Telepsych may alleviate client load size by being more flexible with scheduling and staff availability. And last, integrating. Integrate details the end goal of implementing the use of telepsych within outpatient behavioral health. It is important to update current trends and streamline inpatient behavioral health with outpatient behavioral health for all current locations. Integrating care between inpatient and outpatient using telepsych would improve readmission rates due to telepsych's ability to reach care to more populations who may struggle to obtain care once discharged from the inpatient. Streamlining these two systems is a complex problem, but telepsych would assist both in the communication between each other and clients, which does not currently exist within the two separate systems and databases listed. Here I will introduce both the needs and the choices for changing and advancing care with telepsych is a necessity for our served population. Within the past few years, especially since the beginning of COVID, the public as well as our hospital providers have begun to see the need for change in the delivery of care. Current systems within outpatient behavioral health has shown the problems involved with staffing shortages, patient barriers, transportation needs, and illnesses. Patients who do seek care often struggle with these transportation needs and limitations requiring them to leave their homes. It is very common for patients to not show up to appointments, which results in them not having any access to medication refills and subsequent higher readmission rates into inpatient units within the first 3 weeks of being discharged previously. There needs to be a problem addressed with more options, easier options, and cheaper options, as there are much more common barriers. The need for a shift in the delivery of care to patients post-discharge from the inpatient unit and within outpatient units has been a popular topic among integrating systems. Current trends and patterns of delivery of care is limiting. Now, thankfully more than ever, the usage of telepsych as an option is a known option of care for those seeking that care. This places the choice of the hospital to adapt to the needs of the served population or stay stagnant and complacent in older times. In addressing how I plan on implementing my project, I will share why this implementation both addresses my competency number 4 and underlines the importance and how the delivery of such system is needed to be completed within the first 3 months. I incorporated competency number 4 by seeking several resources of information to build from so that I can be accurate, detailed, and deliver this grand challenge in an impactful way. These resources include ongoing journaled research done through outpatient care and digital health, interviews with leadership staff to find out details on the demands that might be favored in being met, and asking clients who may benefit from this resource that they would find most helpful to their situation if they were to utilize the digital behavioral health platform in their care. Here is a basic outline of the first steps in implementation of telehealth within UnityPoint Health outpatient behavioral health setting. This is a 2 to 3 month plan, and I will be using a software called eVisit, which is a common online software which is used for hospital systems that includes provider and client data for face-to-face telecommunication. During this first month, we would need to purchase the subscription software, eVisit. We would need to make and change current policies related to telecommunication. And lastly, we would need to establish infrastructure and hardware in our designated locations. We would start with 4 total units located at 2 different locations, 2 units per location. During month 2, we would establish an environment that these could be used in and delegate licensed staff compliant with state and federal law to practice here. During month 3, there would be a training of this eVisit system with staff. An evaluation of the effectiveness of eVisit will begin after the 3rd month. And then every 4 to 6 months, it will be reevaluated to see if changes are needed. The populations that this would serve include both Peoria and Tazewell County. The nickname for Tazewell is currently Tazwood, as it serves both Tazewell and Woodford County. Woodford County does not have a system, and it utilizes Tazewell's system. Woodford data is included within Tazewell's system. The population served within Peoria and Tazewell/Woodford County systems. Peoria, Illinois system, which currently serves about 1,500 clients. The population of Peoria County as of 2021 was 179,432. Our clients must be 18 years or older. Many are on Medicaid or Medicare, and some on private insurance. We have a very large homeless population, which does receive care. There also must be a comorbidity of mental health and physical health diagnosis present within the client. Next, Tazewell and Woodford. Current client base that they serve is around 650. The area for Woodford and Tazewell as of 2021 census is 168,637. Again, like Peoria, all must be 18 years or older, many on Medicaid, Medicare, with some private insurers. There is a smaller homeless population here. Majority of clients come from smaller towns or rural areas. There too must also be a comorbidity of mental health and physical health diagnosis present. What does the current data and research provide? I used the NASW Code of Ethics Standard of Telecommunication and Technology Practice section. Here I was able to find some very valuable information benefiting the importance of implementing telepsych within our current system. Other current data on the next slide was obtained by an academic journal about meeting the challenges of telepsych from the perception of an MSW student. There's much data and research that has proved beneficial to my topic. Here I will focus on 3 of those. Mental health care was the very first social work application that used telepsych technology, and it also continues to remain the most important. Nearly all portions of a social worker's interactions on the job is done face-to-face, which theoretically can be done online. There is evidence supporting the usage of telepsych that provides validity and reliability. There was a study at Central Massachusetts Medical Center in which they found that the telediagnosis and plan of care for individuals provided a near perfect correlation, 0.85, to in-person care diagnosis and plans of care. Mental health assessments provided over telepsych provided a correlation of 0.89 between online and in-person results. Lastly, the NASW Code of Ethics, Standards of Technology in Social Work shares an emphasis on the need for social work to evaluate and stay up to date of emerging, knowledgeable, associated technologies to social work, which includes the usage of telepsych. In addition to the available research, I looked into the HCFA, which stands for the Healthcare Financing Administration Policy, on what current client insurance coverages and costs look like for Medicaid and Medicare clients using telepsych. Another point that is important within current research are the implications of preference in which the client prefers and how they receive their treatment. After all, the use of telepsych needs to be supported by insurance coverage and made sure that the population utilizing telepsych prefers such delivery of care over face-to-face. Here I will be covering how some of the research that I found could be beneficial to implementation within my project. The Healthcare Financial Administration, again, HCFA, luckily changed insurance coverage on Telepsych in October 1st of 2001. Prior to 2001, all Medicaid and Medicare insurers required face-to-face therapy to receive coverage. Following Medicare and Medicaid legislation within the Benefits Improvement and Protection Act, SCHIP, SHIP, coverage was expanded to also cover telepsych services, allowing an increase in services from mental health online therapy and appointments. Listed after is the volume in which that can be found within the policies. Telepsych patients are way more likely to become socially unstratified. Telepsych de-emphasizes differences related to discrimination, forming a more equal relationship between the users. This results in a higher trust and acceptability between the client and provider. The results of this viewpoint point out that there is a more equal powered relationship among the attended users. Prior to any use of the software of eVisit, the biggest challenge that I found to even get this program up and running was the integration of Telepsych facing financial problems. The pre-programmed software itself is not much for the organization cost-wise. The cost comes from other areas, such as the technical support needed, hardware that supports the use of the software, and the staff to operate and support the systems. Here's a visual to see the financial hurdle the company might face for the challenge of using eVisit for Telepsych. eVisit, at its lowest price, comes at $600 per month for its subscription. This must be paid every month to use its services. Next, I looked at the computer portion of it for hardware to support eVisit. Here, the HP Pavilion PC and monitor bundle costs $554 per unit. We are using 4 units, which comes to a cost of $2,216. Next, the technical support team by eVisit comes free with the subscription of eVisit, but the staff labor of installation of the hardware used would need to come from UnityPoint Health technicians. Here, I was able to find the salary of an entry-level technician at UnityPoint Health at $50,036 yearly. That is $24.06 hourly. The committed staff would be at about 10 hours of labor each, which comes to a total from the company to support the labor of UnityPoint Health technicians to place this hardware at $481.20. I allowed some wiggle room for this project as errors can occur, things can happen, or more needs to be purchased. So I added $750 for this. Adding the total to implement these 4 systems, 2 at each location, would cost the company around $4,047.20. As an intern, this journey has been remarkably beneficial to my future career and my lifestyle as a social worker. Learning how policies are formed, how they are implemented, and the technical background behind that supports advancing ideas has given me so much motivation that I honestly would prefer to eventually work in policy myself in the future. What have I learned as a new social worker? As this list would be pretty big, I wanted to focus just on these 3. Within healthcare, Creating policies and actually implementing those policies to establish new ideas are both completely separate events that take a very long time. Being in social work, you must accept errors, differences in planning, or others' ideas, and be open to learn from your own mistakes. Telepsych implementation can be the very beginning to other ideas and is never the end of a plan with an increasing access for care for all. Listed below are the citations used to assist me in this project. Each number, which was used in previous slides, correlates to the citation that is listed next to it. I wanted to say thank you to all the individuals who do work for Unity Point Health. Those names will be censored and not used in this project. Again, thank you for coming to my talk and walking with me during this remarkable journey.